Welcome back, friends. I'm Dr. Catherine Y. Brown. As you know, I am on a journey to interview 100 voices of pulmonary hypertension, patients, caregivers, medical professionals, and even you. Today, I am excited to introduce you to my guest, Wendy Berry. Welcome, Wendy.
Hello.
So for our viewers around the world who are going to meet you virtually via this interview, and can you please share with them who is Wendy and also where you're joining from?
So I am retired. I used to be a squash coach and player for very many years. As you can hear from my accent, I'm not from this country, but I live here now, and I live in Massachusetts in a town just outside of Boston called Newton.
Awesome. And where are you originally from?
I'm from a town called Brighton on the south coast of England.
Wonderful, wonderful. Well, again, thank you for being here and agreeing to share your story with all of our viewers. It is my hope that they will learn something amazing from you, and I know that they will. So my first question is, as we think about those two words, pulmonary hypertension, when was the first time that you heard those words?
When I was in hospital having a catheter, I had a catheter, what do you call it? Not surgery, but my cardiologist sent me to get a cath done because I had been saying to him over a period of months that I was short of breath, and my heart was pretty good. And so I was sent to have this done in hospital. And when I woke up, the doctor who did the surgery or the operation, whatever you like to call it, procedure, I think is the correct word, I said the heart looked fine, it was squeaky clean. However, you do have pulmonary hypertension. And that was the first time I'd had heard the two words. And I had no idea what it was. So that was back in 2017.
Okay. So once they told you had pulmonary hypertension, did they talk about treatment options, or what was that journey like, and what was the time frame from the diagnosis to the treatment options?
Well, I went back to my cardiologist, having learned about this. The surgeon at the time was not going to give me a full-scale dissertation about pulmonary hypertension. So I went back to my cardiologist, and he then referred me to a pulmonologist in Boston, at Beth Israel Hospital. So then I went to see this pulmonologist, and I got the picture of what I had, but didn't quite really understand what it was. And it's taken me, a few months to figure out, and reading a lot about it to find out what it was, but it was scary.
Yeah. So first of all, I'm glad you got the diagnosis and that you had the pipeline of referrals to go back to. What treatment options did they find that worked best for you?
Well, I went through a series of tests, as I think most people do, because they weren't able to pinpoint the reason why I had it. And because I was an active person, and the only thing that I complained of was being short of breath. And so I think you call it a workup. I had a workup, and it was thought that perhaps I may have clots in the lungs, which I was obviously surprised to hear because I had no reason to think that I had had any problems other than being short of breath. So I was sent to Mass General Hospital and had a VQ scan with the nuclear color, and they and I had a right heart cath at the same time, and they discovered that I had these tiny tiny scar tissue in the distal ends of my lungs, or one area in particular, and they came up with this word CTEPH. So that was the diagnosis. However, my pulmonologist, who moved on, I was then sent to another pulmonologist at the same hospital, and he came up with a mixture of reasons as to why I have pulmonary hypertension. And it appears that I had, as a child, taken a pill in England, a diet pill called Ponderax, which is over here called fen-phen. And that could have been one of the reasons why I got pulmonary hypertension, along with these small scar tissue blockages in the lungs, along with sleep apnea. So I'm a real mixture of group 1, 3, and 4. So that's how I got diagnosed with PH.
Amazing. And the reason why it's amazing to me is that the team took time to really explore all of the possibilities, and you don't always hear that journey for people, right? And so to me, that they looked at, it could be this, but it could be this, but it could be this, but here's how we progress forward. And so there's some hope in that as well.
I have to say, I was really amazed at how well my first pulmonologist at Beth Israel, after she saw the VQ scan, or yes, it was a scan, she was not certain. When the scan was read, they said it looked normal. However, she didn't think so. So that is when she sent me to Mass General Hospital to get a better scan done with the nuclear infusion. So really, it was her who didn't accept the findings originally. So I will be forever grateful for her. Can I mention her name?
You can, absolutely.
That was Dr. Debbie No at Beth Israel Hospital here in Boston.
Wonderful. And I'm sure
I'm forever grateful to her.
Wonderful, wonderful. So what is life like for you? A typical day for you, Wendy?
Oh, a typical day for me. Well, I used to be teaching, but I've since fairly recently given that up. But a typical day for me is, especially during the summer months, is to go out and play pickleball for a couple of hours. I was a squash player, but 4 knee arthroscopies, a ruptured Achilles tendon have basically put an end to my squash playing days. So I've had to turn to another sport, another racket sport, in order to be able to remain active. So, I mean, I do play tennis, but because of my knees, I can't run around a tennis court as easily as I can run around a pickleball court. So I do that on any day that is, really nice and not too hot. I have a little garden at the back, so I spend time in my garden growing herbs and some flowers. I like photography. During COVID, when people couldn't go out, I decided it was a great way to get out was to actually walk through cemeteries. So in the Boston area, my partner and I would walk every day through one of the cemeteries that was around. And we liked that because there was nobody else around. And there were big paths, big roads, and the place was empty. So we did that. And during that time, I started photographing wildlife. And particularly in one cemetery we have here, there's a bald eagle's nest, and the pair come back every year and rear chicks there. So for me, I'd never seen a bald eagle in my life, obviously. And it was great. It was absolutely awesome. And the other thing that was amazing was I saw a coyote for the first time, 10 feet away, 10 feet away from myself. So after I'd seen both those different sorts of animals, I decided, I'm going to take my camera every time I come to the cemetery because there's going to be something I'm going to photograph. So I'm in the process of putting all those nature photographs together, and hopefully we'll post them on Instagram. But this all happened during COVID.
Wonderful, wonderful. And how can people, are you sharing the photographs so people can look at the beautiful nature?
Well, interestingly enough, I did share them with, and I shared this story with the PHA, Mike Knappen, who used to be the patient advocate person at the PHA before he moved on to another rare disease. I sent him the photographs and an article of that. It didn't get published, but he said it was lovely, and that people in the office sort of enjoyed looking at the pictures and hearing about how they came about.
Wonderful. So in terms of for you right now, do you have do you do oxygen at night? Do you do any medications? What is that journey like currently?
Yeah, yeah. I have sleep apnea, and my saturation level drops. So I do have a concentrate. I have oxygen at night, which is fed into my CPAP machine. So I guess you call it BiPAP. I'm not sure, but I think. So I have that at night, every night. It's a bane of my life, to be honest, because masks don't fit terribly well. However, you have to get used to it. So as far as medications are concerned, I'm on ambrisentan daily and torsemide, the diuretics, because I do get swelling of the ankles, so I'm on that as well, and a few other things, but I'm not sure that they're pH related.
Gotcha.
I can give you a long list if you'd like.
So
those are the pH medications that I'm on. Yeah.
Awesome. So I love that you have options. I love that you got great care. You got your questions answered, and you have a provider that has done wonderful things for you. And that's not always the story. So when we get that story, it's beautiful. It's a beautiful story to hear, and that you have a sport that you enjoy, and you're enjoying nature, and you have hobbies. So for our viewers, things may look different, but what I do want you to take from Wendy's story is that you can pivot and you can find something that works for you. Be it photography or walking or whatever that is, that it may look different for someone else, but as long as it works for you, it's a beautiful thing to have. Wendy, I have asked you so many questions. What do you want to share that I have not asked you?
Oh, wow. Well, when I was diagnosed back in 2018, I decided to join the PHA Boston walk, which I did. And at that walk, I met Mike Knappen from the PHA, and we had a discussion because I said to him, you know, I'm new to this. I don't know anything about it. I don't know anybody who has PH. You know, how can the PHA help? And he said, well, we had a support group in Boston, but it had lapsed. And so would I be interested in joining that group as one of the leaders? And I said, yes, of course, because obviously I was going to then meet up with other PH patients and caregivers, and it would allow me to ask lots of questions of people like you're doing now, asking people who have PH, you know, what is it like for you? How different is it? So since 2018, I have been chairing the Greater Boston support group meetings that we give, you know, offer to anybody in the Greater Boston area every 6 weeks to 2 months. And we try very hard to get speakers for the majority of our sessions. And we have called upon many doctors in the Boston area to come and speak to our members, and it has been enlightening and has given a lot of people opportunity to ask questions, which they wouldn't be able to do in their very brief time they spend with their own consultant. So it has been really good.
How do you find the speakers? Is it difficult for you to get speakers? Are they mostly providers that are seeing some of the members? What is that process?
Well, when we started, after I had said, yes, I will join this support group and help lead it, I immediately asked my own consultant and said, would they speak? So the first one was somebody who I knew, and they were very happy to do that. And since then, my consultant, my pulmonologist, has spoken 3 times. And so it was a sort of knock-on effect. And a lot of people who joined our groups then said, okay, I've got this speaker here. Could we ask them? And yes, so we've had a multitude of different speakers speak at our meetings. So, which has been really enlightening.
Excellent. I love it. And so if you're in Wendy's area, just know that this is available to you. And there are many nonprofits that are growing now that are doing good work. So you do not have to be on this journey by yourself, and finding other people who have something in common. Really, it really does. It absolutely does help. So yes.
I'd like to, could I just make a shout out for my co-leaders? So that's Mary Claire McGraw and her father, Tom McGraw. They are co-leaders of this support group in Boston. Due to Tom's wife, which is Mary's mother, has PH. So they are involved, and Mary Claire is our wonderful technical leader, and Tom is our speaker leader. He finds speakers, and between the 3 of us, we set these meetings up. So yeah, I just wanted to make a shout out to them as well. It's not
absolutely just yeah. About how many members do you have in your support group? How many members total?
Well, when we first started, it was before COVID, and we would probably get about 15 to 20 people turning up. Once COVID hit, we had to go onto Zoom, and Ring Central, actually, PHA used Ring Central, and we would get generally, I don't know, 10 to 12 people at our meetings on Zoom. And a lot of them were familiar faces that would come each time. My disappointment is that we don't have more. I want to get through to more people. We have a Facebook page, which we also, put things on about assistance funds when they open up to assist people with the financial cost of drugs. So we have a Facebook page, as well as we have a database, and generally I contact one or two people and have a chat with them just to see how they're doing. And that's really, that's how it works. So
I love it. So my last question for you is, as I continue on my journey to the road to 100, what words of wisdom would you give to me?
My thought is, I think you're doing a fantastic thing, because I believe there's not enough out there for people to know about pH. And if you, in your your journey of getting people to talk about this, hopefully it will get through to other people. When I told my family I had this pulmonary hypertension, they all said, "What's that?" And because it's a rare disease and doesn't receive the same sort of funding as all the other big diseases that we see on television, I want that to change. I want pH to be out in the forefront, as well as cancer, diabetes, Alzheimer's, AIDS, heart problems, all of those. I want to see pulmonary hypertension out there along with those diseases too.
Absolutely. I agree with you 100%, because it has to not be the first time that someone's heard it is when they're diagnosed. That was my mother's journey, and pretty much the majority of people that I have interviewed, that is a common theme, and it's going to take all of us to work together to change that. So I'm committed to it in my mother's honor, and through your support group leadership, you and your team are doing it as well. So I thank you so much. And thank you again. I'm sending you a virtual heart all the way from Nashville, Tennessee.
Thank you. All the way up to Boston. Well, thank you for doing what you're doing too.
Thank you so
great.
much.
It's great.
And
I look forward to seeing the result.
Yeah, so today is August 2nd, 2022. I am in the 30s now, early 31, 32. And so I am across that threshold. So, only 60 plus more to go. So
shouldn't take too long. And if you're looking for people, I'm possibly able to give you some names.
Absolutely. Thank you. And
I'll contact them and see if they would be interested.
Oh, thank you so much. And it's a community. What I love about this community is there's so much love. Even as when we first started the nonprofit, I was scared. Like, I'm an only child. I got 4 children. I don't know what I'm doing. And they helped me. And even with this project right now, I just really feel, and I'm a crybaby anyway, but just such a sense of gratitude that people understand my heart of what I'm trying to do, that I'm still just a daughter and a caregiver, just trying to do the work and continue it. So I'm so thankful to you for helping to connect me with other people. And so just thank you again, Wendy. I really appreciate you.
You're very welcome. And I hope this project is a great success.
Thank you. And for our viewers around the world, you've just met Wendy Berry. Please share her message. Share this with patients, caregivers, medical professionals, the community, because there's something that we all can learn from each other through sharing our stories. And it is my goal to honor every single story in the most beautiful and positive way. So until next time, I'm Dr. Catherine Y. Brown, your host, and I am on the road to 100 interviews. So please continue to follow my journey. I'll see you all soon, friends. Thank you so much, Wendy. I appreciate you.
Welcome.